October is National Breast Cancer Awareness Month, so joining me today are Dr. Rock and Dr. Andersen from Port Neuf Medical Center. Thank you both so much for being here today to talk about such an important subject.
Sure.
So of course, we just mentioned that October is Breast Cancer Awareness Month, and one of the key things with awareness is you gotta know if you have it or not, right? And that early detection is critical. Just kind of explain to us from the medical perspective why that is so important to have that early detection.
Yeah, so I think an important statistic to talk about is that 1 in 8 women will get diagnosed with breast cancer at some point in their life. So it's really common, and most of the time that's not because you have some gene that you carry, but it's just random and bad luck. And so given how common it is, being able to find it early as possible is always ideal, and the best and most effective way to do that is through mammogram and screening. And just like you alluded to, the sooner that we can find out about these, the more effective treatments are and the more likely that patients can be cured of it.
And talk to us a little bit about when people should be getting the screening, kind of the generic age, and then if people have a family history or maybe they're high risk, should they be going in sooner? Talk to us about that.
Generally, it's recommended that women start screening at 40 years old, and mammograms are typically done every 1 to 2 years, but talk to primary care about it. That's for women that are generic risk, the 1 in 8 women that will get breast cancer. But if you have family history of breast cancer, talk to your physician, but you should be getting screened more earlier or more frequently.
Okay, and talk to us also just a little bit about the process of getting your screening, getting the mammogram, because I know it can sound scary and kind of sound intimidating for a lot of women, and we put it off. Just tell us a little bit about what we can expect when we go in for those.
Yeah, so there's different ways to have it done. We have our mobile units, but when you go in, the staff there will be really welcoming. They'll help walk you through everything, and there's various views that they'll do with the mammogram that just help the radiologist get a better look at the breast tissue and be able to make sure that there's nothing concerning. If they do ever find anything, sometimes you'll get a call back just to say, hey, we need some additional views or to take another close look at this, and sometimes you'll be called back to do that. If there's anything concerning, the best way to find out and look more in depth is to do a biopsy of it, which is just a little needle that's placed into the tissue to take a sample so that we can get a closer look at the tissue and just make sure there's nothing going on, or if there is, to do something about it.
The technology has come a long way and it makes the process a lot more simple, a lot faster. Mm-hmm. Okay, and then just talk to us a little bit about, obviously breast cancer could potentially happen to anybody, but are there some things that we can be doing to maybe help lower the risk of getting breast cancer?
There are a couple things, but really the main thing is just the risk of breast cancer death. Dying from breast cancer or having serious breast cancer is catching it early. That's by far the best way. And the cure rates are so good with early breast cancer. So I think that's got to be our main point, is just making sure you get checked before you have any symptoms.
Sure. Okay, great. Thank you both so much. We appreciate you being here today.